The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. Pennsylvania is #1 in the U.S. for reported cases of Lyme disease, and cases are increasing each year. Lyme disease is transmitted to humans mostly by the bite of infected black-legged tick. The tick expert with the State Department of Environmental Protection weighed in on whether it will be a bad year for ticks.
Every year's a bad tick year because they can carry things that can make us sick.
The state wants to keep you informed about tick-borne diseases and has launched a dashboard. You can find it at the State Department of Health's website. Tonight, we'll talk with someone who's been living with Lyme disease for years, and we'll discuss how Lyme disease is treated. We'll also talk with a veterinarian about keeping your pets safe from ticks. We're putting ticks and Lyme disease in focus. Joining us now is Eric Huck. He's the co-founder and president of the PA Lyme Resource Network. Thanks so much for being here.
Happy to be here.
Eric, how did you get Lyme disease?
I got Lyme in the spring of 2009. I was hiking the Appalachian Trail. I had come back, and 2 days later, on a Monday evening, I was watching television and I realized I had an embedded tick behind my knee and an embedded tick in my groin. I took the ticks out improperly, went to a doctor the very next day to say, what do I do? And I was given 10 days of doxycycline and an antibiotic preventatively. And I thought everything was fine until about 3 months later when I just got so sick so quick, and that started my Lyme journey.
When you say so sick, what happened?
Well, for me, it was a lot of headaches, body ache, joint pain, muscle pain, heavy fatigue, flu-like symptoms that were so severe, could barely get out of bed, body sweats, and just an inability to really be physically functional or even mentally functional.
Wow, that really changed your life.
It did, absolutely changed it.
When you say you removed the tick improperly, what do you mean?
I did what nobody should ever do. I thought you burn them out, so I heated up a paper clip. That didn't work, and then my neighbor, when I couldn't get them out, I called my neighbor, and he removed them with pliers. And it wasn't until the next morning when I looked at how do you remove a tick, I realized that's the absolute worst way, because it traumatizes the tick, and they regurgitate everything from their inner gut, and so I got a full dose of all the bacteria that they were holding on to.
So why didn't the preventive treatment of doxycycline work?
Well, I'm not convinced that it ever does, to be honest with you. Some studies say that preventatively, maybe you need to take 2 to 4 weeks. You know, you got bit by a tick, you removed a tick, you're not 100% sure you have Lyme, but preventatively, something like a doxycycline for 2 to 4 weeks. The doctor that I went to thought 10 days would be sufficient, and I just know anecdotally that there's a lot of individuals that say that didn't really work for them either.
And this is still impacting your life all these years later?
Yeah, very much so. I'm functionally a lot better. So I've been fighting this for 15 years now. I have gone to multiple doctors. Not only the Lyme disease, ticks carry 11 different diseases in the state of Pennsylvania. So because they were in me for so long, 2 days, and because I took them out incorrectly and traumatized them, I also was infected with Babesia, Bartonella, Ehrlichia, Anaplasmosis, Protomyxoa rheumatica, as well as Lyme. And so those other between, protozoa, between bacteria, between virus, that's what had me become so sick and stay sick for so long. So I finally found a Lyme doctor. The first doctor I went to, you heard about bullseye rashes on the body. I had 20 rashes all on my body, standing in front of the doctor, and the doctor says, it's absolutely not Lyme, because 3 months ago, you took 10 days of doxycycline, so it's not Lyme, and I was given skin cream for rosacea. Took me a while to get positive blood tests to find a doctor that says, yeah, that's not only Lyme, let's do tests for other co-infections, and that's where the other diseases were detected. And I, for 3 years straight, treated for those rotation of different infections.
Well, we'll talk more about your situation and what the PA Lyme Resource Network is doing. Our discussion will continue.
This is WGAL 8 in Focus, coverage you can count on.
We're back with Eric Huck, who's the co-founder and president of the PA Lyme Resource Network and a Lyme disease survivor. That's for sure. You've certainly had an ordeal. Do you think there's a proper treatment out there for the general population?
I believe there is proper treatment, but it's difficult to find. There's two sets of Lyme guidelines that are floated in the medical community. The one set of guidelines is promoted by the CDC, and those guidelines, when you look at them, they say that Lyme is difficult to get, easy to cure. Once you have a diagnosis, which is difficult because 50% of the blood tests come back unreliably negative when in fact they're positive, and the protocol is 14 to 21 days of antibiotics. The challenge is that doesn't work for everybody. Maybe 70% of the people, 80% of the people get better with that, but there's 20 to 30% of the population. That's not sufficient. And after the treatment, the CDC says there's nothing really more that we can do for you. Chronic Lyme is debated in the Lyme communities.
I know it's somewhat controversial whether there is something called chronic Lyme.
And why it's controversial is really difficult to understand, because chronic Lyme simply means that after you take a short-term round of antibiotics, do you still have the Lyme disease? Do you still have Lyme bacteria? And the truth of the matter is, yes, for a lot of people, a short-term round of antibiotics doesn't kill all of the bacteria. There are 700 studies on persistence, meaning after antibiotic treatment, Lyme is still alive. In mouse studies, in animal studies, monkey studies, even with humans, that it shows that persistence is real. The challenge is the CDC says, well, it's not chronic Lyme, it's post-treatment Lyme disease syndrome. You've already been treated short term. Okay, you're sick, you have symptoms, you still can't go back to work, but maybe it's not because of the Lyme, maybe it's because of something else. And so what we say is, okay, whether you call it chronic Lyme, which we believe it is, or post-treatment, still treat the patient. And that's where the other set of guidelines comes in. There's an organization that's called International Lyme and Associated Diseases Society. Their set of guidelines says treat the patient till they're better, chronic Lyme is real and it exists, and don't always treat by a negative blood test. Interview the patient, and it's a clinical diagnosis, and treat accordingly till the patient gets better.
What is the PA Lyme Resource Network doing for folks?
Well, PA Lyme Resource Network, we were really conceived out of a couple of local support groups that got together to say we need to do something in the state of Pennsylvania. You know, the worst state 11 out of the last 13 years, so it's bad, bad, bad. But what are we doing to support local communities? And we created PA Lyme Resource Network. We have 20 support group regions that work in different counties, different localities, working with their communities. Education seminars, prevention seminars, we do patient seminars, we hold medical conferences for doctors on the better guidelines, the ILADS guidelines. As a nonprofit 501c3, we have an extremely dedicated organization that just wants to help the community not get sick like we did.
Well, Eric, you've certainly become unwittingly to become an expert on this, so we appreciate your expertise and your time.
Yes,
thank you.
My pleasure, thank you.
Coming up on WGAL 8 in Focus, we'll talk with a doctor about prevention of Lyme disease and the treatment.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Dr. Nitin Patel, the Medical Director of Infection Prevention at LG Health. Thanks so much for being here.
Thanks for having me.
Who's at risk for Lyme disease?
I think all of us, because Pennsylvania is a high incidence state, so we all are at risk. It's throughout the Pennsylvania, all counties, they have high incidence of tick.
Yeah, it's pretty scary how the numbers have really gotten really out of control.
That's true, I think, and we are seeing more, obviously Lyme infection is one of them, but there's other infections tick carries. We also see uptick of those infections too, which used to be like uncommon, but now we see it.
Yeah, the symptoms seem to be kind of all over the place. So how do you know if you have Lyme disease?
So I think the biggest clue that helps is, the risk you got, like if you have an exposure to tick, something you did like camping or even wooded area, and you may have tick bites. I think that's a clue. Symptoms are not specific, unfortunately. So it's like fever, chills, body aches, myalgia. This could be from a lot of things, including viral syndrome. But I think biggest clue is to, like if you have exposure history. And then if you do get those symptoms, I think get tested. There's a good test you can check, like we check for titer, and treatment is available too. Like, it's very effective. If it's done like early phase of the infection, treatment can prevent a lot of complications.
Is the treatment still much the same, antibiotics?
Treatment is it's still the same. There is one of the antibiotic called doxycycline still remains the main treatment. So if you're allergic to doxycycline, we do have other options too. But yeah, it's still antibiotics are the main treatment.
And there are dangers of having these symptoms if they go untreated.
Definitely. So the Lyme infections mostly, we'll have like, the rash and the fever, but we see complication from the Lyme infection. So, some of the complication, like it can infect your heart muscle. That's called Lyme carditis. It can cause heart blocks. It could be deadly if it is not treated or not identified. Sometimes we see the Lyme causing like a brain inflammation, meningitis or encephalitis, and that can be also serious complication.
So what's the best prevention?
So the best thing to prevent is to avoid tick bites. So if you are going into the area where high tick prevalence, you want to be prepared. So I tell my patients, when you are going to a wooded area, number one you can do is to use, there are chemicals like DEET, permethrin. It comes in a spray bottle. So you take a spray bottle, put it on your cloth, let it dry. So that will prevent tick bites. When you come back, like from your trip or like even your yard, you want to check for ticks. And usually tick likes to be in like a warm area, so underarms, groin area, behind the legs. I think those are the places, hair, those are the places the tick will hide. Taking like a warm shower will help to detach those ticks. And if you find a tick, you want to remove it.
And what's the best way to remove it?
So the best way is, the trick is, I think it's a good picture illustration here. So you want to use like a tweezer or forceps with a fine tip. You want to go as close to your skin and try to grab that tick firmly, and you want to use perpendicular force and try to remove the whole tick. So the trick is, you don't want to you don't want to like twist it
or pull it horizontally, right?
That will break the tick's head. That's where the saliva will still transmit the infection. So you don't want to like even smash it. So that will also, same thing, like a blood will release, and that can still put you at risk of getting infection.
Or use a match or petroleum jelly, things that people often talk about.
So that's the big no. So you don't want to use any petroleum jelly, or you don't want to use any kind of matchstick or burning. Same rule apply, is you don't want to the tick to release more, because once you burn it, I think it will release more bacteria. And it's the same thing, like if you squeeze it, the blood will get released.
And how can you be sure you got the entire tick?
So when you remove it, you want to store in or you want to just put it in a Ziploc with it, and you want to check if the head is there on the forceps. So that's how you can confirm. Now sometimes we say, like, if say the tick looks pretty engorged, and you're not sure, you may want to reach out to your primary care physician or family doctor. If you get tick bite and the tick looks engorged for a while, and the doxycycline we can also use for prevention.
Preventive care, yeah.
So that would be another thing.
Because
to think
that
about.
means the tick may have been there for
Tick may
a
have been
period
longer,
of time.
right? So longer it stays. There's more chance. So usually it takes about 24 hours for tick to release the organism to cause a Lyme infection. But tick can carry other infections too, like there's a couple of infections, Anaplasma and Babesia, and that does not require tick to attach too long.
It's scary, but obviously you don't want people to panic.
Right, so that's a trait. Like, it's treatable. You don't want to be panic. You want to act, as I say, calmly manner. Don't try to, burst the tick. That will make things worse.
All right, Dr. Patel, thank you very much.
Thank you.
Coming up on WGAL 8 in Focus, we'll talk with a veterinarian about keeping your pets safe from ticks.
This is WGAL 8 in Focus, coverage you can count on.
We're joined now by Dr. Jen Morris of Pine Creek Animal Hospital and Amanda Ryder, who's a certified veterinary technician. We also have Aurora and Chowder with us. Thanks for bringing them along.
No problem.
No problem.
Thanks for having us.
Yes.
Dr. Jen, as your uniform says there, is that okay to call you that?
That is absolutely fine. I don't get too hung up on the doctor part either. Jen is okay.
How common is Lyme disease in animals?
It's pretty common, especially if the animals are very prone to environments that they're going to pick up some ticks that are going to carry Lyme disease. So if I have, someone has a 5-pound Chihuahua that never touches the ground, the chances of this dog getting in contact with ticks will do it, that will cause Lyme disease is not going to be real prevalent. So our biggest concern are the dogs that are out and about. Lots of clients come in and say, hey, I take my dog hiking, or I'm on the rail trails. Those are the dogs that we worry most about, but not that your Chihuahua can't get it in your backyard just walking through, easily can pick up a tick. I think most people think I don't have deer in my backyard, or I'm not seeing a lot of wildlife. It doesn't mean they're not there. So big carriers of the ticks are not just deer. We're talking possums, raccoons, skunk, fox, and we all live in Lancaster County. Those things are everywhere, even in your neighborhoods.
A lot of them, yeah. Amanda, how important is it to check your dog every day, or how often for ticks?
It's actually very important. I was actually just telling her a few weeks ago, I found a tick on Aurora's head. We went camping for the weekend, and even, as diligent as I try to be to make sure they're not covered in ticks when we come home, it was a few days later I found it.
Wow.
So they're out there, and they're pretty bad, so we need to stay on it.
And I imagine it's harder to find it on a black dog with a lot of hair than on a small dog like this one that has white hair.
Yeah.
Yeah,
it was a lot easier to find it because it was on her head, but they do like to burrow behind their ears, on their neckline, in their, areas between their legs and their arms where it meets their body. So it's a lot harder to find it on these long-haired dogs than it is on these shorter-haired guys.
Now, Dr. Patel explained that to pull it out vertically, he said, with a small tweezers. Is that the same method for an animal?
Yep. And people tend to get, we have clients that call and get very panic if they have left the head into the dog's skin. And a lot of times you can actually do more damage trying to dig that head out. The Lyme organism lives in the body of the tick or in the gut of the tick. So as long as you've removed most of that body or the belly, really, it's okay if the head or even little pieces of the teeth or the mouth are still there. In fact, I find more clients do more damage trying to dig everything out versus the body will expel it naturally.
What about prevention in animals?
So we love prevention. We definitely use a combo platter of different things. So my dogs are all on the Trio by Simparica, which I love. It's a once-a-month oral pill. Some people don't prefer the pills, or their animals either won't eat it or is not good for them. So there's some topicals that we love too. So Frontline is a liquid topical and Advantix, and then the Seresto collar works beautifully and lasts for 8 months.
And you find those work pretty well?
They do, and the collars are really nice too for the more athletic dogs that go swimming and out, and they're still fine to keep those on. And it is nicer to have double protection because these ticks are they're out there and they're
Yeah,
pretty
very
bad.
prevalent,
Yeah.
that's
Yeah,
for sure.
if I have hunting dogs that clients own, I will sometimes have them use more than one product, just because if they're out in the woods and they're hunting deer and other things, their chance of getting any of the tick-borne diseases, not just Lyme, is enormous.
And there are other infections they can get.
Correct. Ehrlichia anaplasmosis. We've actually been seeing at the hospital in the last few months more anaplasmosis positive dogs than we have been seeing Lyme positive dogs. So I think some of it is also the tick makeup is changing of what they're carrying, and it depends also too on which tick species as well.
And what kind of long-term effects can this have on the animals?
So one of the biggest things we do see is what's called Lyme nephritis, which is when they can go into chronic kidney failure from this. So symptoms that owners do typically notice are limping, intermittent lameness usually, and we do see a lot of lame shiftness as well, where they will limp one day on their front leg and then the next day they'll limp on their back leg. So it's kind of shifts back and forth. But if the infection gets too bad, we can start to see symptoms of renal failure, which would be, anorexia, fever, fatigue, and then sometimes vomiting and diarrhea as well.
And how do you treat it in dogs and
The
other
Lyme
animals?
disease, it's actually the same as humans. We use doxycycline, both for the Anaplasma ehrlichia and the Lyme. Sometimes it's a different length of duration of using the doxycycline depending on which disease you're treating. But the Lyme's still really effective for all of these diseases, the doxycycline is still really effective for all of these diseases, which is lovely.
What about the Lyme vaccine?
We love the Lyme vaccine. It's just another barrier to protection. And the Lyme vaccine is fabulous. If you knew about the human Lyme vaccine that came out probably about 25 years ago, people were actually getting sick from it. So a lot of vaccines we take and we can vary the organisms a little bit, but sometimes we worry that you'll still get the illness. The new Lyme vaccine in dogs is fantastic because scientists have taken the outer protein of that Lyme organism and copied that so that the body will attack that, and that's what's actually in the vaccine. So we can attack the outside covering of the Lyme so we can kill it even before Chowder. Even
Doesn't
before.
like that, right?
He doesn't like Lyme. It
You
really
know.
annoys him.
Aw. Well, we like
Right,
you.
I know.
And just
boy.
quickly, I was surprised to hear cats don't get Lyme disease.
They don't get Lyme disease, and we don't know why. They're super lucky. I know most people keep their cats indoors, but for those of us who let our cats out, or they go out, especially if you have barn cats or cats that are hunting on your property, it's still important, though, to use the preventatives on them because we don't want those cats bringing the ticks into us and the dogs again.
Right, and infecting possibly humans too. Yes.
Correct. So cats have lucked out, but we still don't want them to be carriers of those little pesky varmints.
All right. Well, thank you so much.
Thank you.
We appreciate
Thank you,
your information.
Susan.
And thank you guys for behaving so well
Thank
and
you.
joining us.
Pretty
We
well,
appreciate
pretty
it.
well.
Ah, he's a good guy. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News. And you can watch each episode of In Focus, plus WGAL's latest newscast, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.